Here to order. First, I'd like to have the invocation, and I'd like to ask my colleague and extremely distant relative, Councilor Crittenden, to give the invocation, please.
Heavenly Father, again, we want to thank you for this beautiful day you blessed us with, for the rain, for the nurture of our grass and trees, and helping to get rid of some of the pollen and all. Father, thank you for all your many blessings. And Father, this health committee that we're meeting in this morning, health is so critical and so important in our tribe. I pray that you'll help us to do good work for our people. I pray your blessings on us as we leave this meeting to go back to our homes this evening. And Father, be with our troops overseas, those that are in harm's way. Bless our governments, federal and also our tribal governments, and help our chairman today and give us all wisdom and knowledge that we might do good work for our people. And forgive us, Father, where we fail. In Jesus' name I pray. Amen.
Amen. Next is roll call. Please acknowledge that you are here.
Bradley Cobb. Janelle Fulbright. Buell Englund.
Here.
Bill John Baker.
Here.
Jack Baker.
Here.
Harley Buzzer.
Here.
Julia Coates. Here. Joe Crittenden.
Here.
Jody Fishinghawk. Meredith Fraley. Here. Don Garvin. Tina Glory Jordan. Present. Curtis Snell.
Here.
Chris Soap.
Here.
David Thornton.
Present.
Kara Cowan Watts. We do have a quorum.
Next on the agenda is approval of the March 17th regular session minutes. We have a first and second. All those in favor say aye. Aye. Any opposed? Motion carries. Next we have reports, and first from the Claremore Service Unit is Mr. George Valera. You are up.
Good morning, everybody.
Morning.
Thank you. We just handed out my report, the written version. We started a new service, the automated telephone appointment reminder system. That went live this last month. In a couple of months, hope to have some data to show that we've slowed down the no-shows. Our outpatient visits for October through March have increased to almost 25% over the same period last year. Revenues are down for the fiscal year, just under 2%. But on the back page there, you'll see that there's a glitch in the Oklahoma Healthcare Authority system, and they owe us $470,000, which they are working diligently to get us. Actually, they've made a small payment of that already to us. So that would put us at an increase over last year, up to this point.
That's a heck of a glitch.
Yeah. New charts, we've actually made more this month than we did last month. We made new charts and reactivated charts. We made 633. That was just for the month of March. Our contract health activities year to date, we've denied and we have unmet needs of $5.4 million. We actually submitted some chef cases in, which those are cases over $25,000. We got 6 submitted and 2 cases pending, and we have 4 others identified already. And I was going to ask if there was anything specific that you want me to cover in this report. It's, kind of brief and to the point. Hits highlights. If you would, just let me know, and I'll be glad to include that.
We have a question from Councilor Cowan Watts.
Thank you, Mr. Chair. After you've had a chance now to review the budget and stuff, have you adjusted the proposed or planned budget for revenues and expenditures for the hospital?
Actually, right now we're pretty much living month to month. One of our problems with our getting our UFMS, our financial management system, the software that we're mandated to use, is that we can't go in and put enough money in it so we can get our contracts paid up a year ahead of time. So we're living off our collections as fast as we can get them in. So there's not a lot of wiggle room in there for adjustments right now.
Do we know anything on the stimulus package about the roof?
Nope, haven't heard anything, and that's one of the reasons we were joking about it out here in the hall. We have a couple of projects in mind. I want to remodel the emergency room and get it turned around the way it should be. Right now, if you've ever been there, our emergency room's backwards. You check in with emergency in the middle of the building after you walk past it, the ER. But we're kind of a holding pattern on any of our projects, hoping that we get or waiting to see if we get any stimulus funding. I don't want to commit any funding to a project and then turn around and lose stimulus money because we've already started that. So we're just kind of in a holding pattern on those projects. But no, I haven't heard anything at all.
Okay, thank you, Mr. Chair. Thank you.
Councilman Bowser.
George, I don't know if you've been briefed on from ODOT about the transportation issues surrounding Claremore Hospital. That's where they're going to be putting that bypass in. I don't think it's going to affect any of our properties there, but I'm just wanting to make sure that you're aware of what is in the planning stages there. What if it's going to impact the safety of patients getting in and out? I don't think it will, but I haven't attended the meeting for the last 2 years. Councilor Watt is aware of that, so I just want to make sure you're aware of it so you keep abreast of what's going on.
I knew they were talking about just west of the hospital.
Yes.
Coming along there, and that shouldn't change any of the accesses because most of the access is from east and south from town.
And when it started, they did propose, and I don't know the name of the street running right next to the hospital, but I think that's been changed to where it actually goes around the hospital completely now. I just want to make you aware of it, make sure that
I'll make a note, and I haven't read or asked about that since I've been there, but I'll do that.
And it's been on the drawing board for the last, I think, 4 years to do that bypass there.
Okay.
I haven't been involved with the planning on it anymore. Thank you, Chair.
Councilor Callan Watts, you're up again.
Thank you, Mr. Chair. Yes, there should be notes. We had multiple meetings on site at the Indian Hospital with our roads folks, CEO Cousins, and ODOT folks and such. And we did stop them from going through Monroe because we just built all those homes and stuff, and we know there's a lot of elderly that's across that street.
Mm-hmm.
So it should be routed around Highway 20, and nobody's told me differently. So, thank you, Mr. Chair.
Any more questions? Thank you.
Thank you.
Next, Cherokee Nation Health Services, Melissa Gower.
Good morning.
Good morning.
I submitted my report, so hopefully you all have copies of that and have read that. Just a couple things. One is just an update on Cherokee Elder Care. As of this morning, they have 23 enrolled participants. They anticipate adding 2 more participants on May 1st and then an additional 2 on June 1st. Which would bring them up to 27. So they're doing very well. They're staying within their budget. And they're expecting their first outside audit since beginning operation. Later this month, CMS and the state will perform a technical audit, which is normally done after 6 months of operation or 20 participants, whichever occurs first. And that audit would give them direct feedback on where they are in their operational growth and provide direction on areas that need improvement. At Hastings, we have 3 new ultrasound machines that are in use there now, 1 in the OB department and 2 in radiology. We have the mammography machine is in. They're just waiting to get that set up. We're excited. It'll be the first time that Hastings Hospital has ever had mammography as a direct service. Probably everyone in this room has had either some direct connection with someone in your family or a friend that you know that's been affected by breast cancer and how important mammography services are. So we're pleased that we have a mammography machine in and are getting it hooked up. We have received our Medicare Part A contract. We got it last week. We will begin billing within 7 days. It takes them 7 days to get the vendor and all that set up. So sometime this week we'll start releasing those claims, and we should see a big difference at the end of this month. Hastings Hospital, we did our very first bariatric surgery this month. Did 2 of them. Went very well. The patients have been followed up, and everything's going great. So that health program is going wonderfully. Matter of fact, the health program has gone so well that we've had numerous people that have gone through the program, and after they've actually gone through the program, either they have made behavioral lifestyle changes and have decided that they don't need the surgery because they're doing it on their own, which is wonderful, or they've decided that they just don't want the surgery because we've been so successful in the counseling process and preparing them for that they just are doing a great job. We also have had some that has lost so much weight that they don't qualify for the surgery anymore. So the whole program is being very successful, and we're very excited about finally having our first 2 candidates in our surgery. So it went very well. We're finalizing, and Councilman Hoskins isn't here, but we're finalizing our Veneta Program of Requirements and Program Justification document this week. We met yesterday and met last week in Oklahoma City, and yesterday we went through and made some changes, and Dr. Grimm's writing up a lot of justifications, and one of those was, as you know, IHS doesn't have mammography as a direct service. I have to say it one more time. And so we're writing a justification to ensure that we get a mammography machine at Veneta Clinic also. So we're finalizing that, and that'll be in by tomorrow. And so we're moving down the road on Veneta. The Senate Committee on Indian Affairs had a staff person that came out and met with health Thursday night and Friday morning. And that was a very good visit, and we toured 3 of our facilities, went to Stillwell Clinic, went to Muskogee Clinic and Hastings Hospital, and had a nice briefing with them. So I think that's all the oral report that I have today. So if anybody has any questions, I'll try to answer those.
Councilor Jordan.
Melissa, our PACE program is currently got 23 participants, and we're going to, I think you just said we'd enroll 2 more probably by May 1st, 2 more by June 1st.
Right.
Are we still on track so that by the end of this fiscal year, they won't have a need to come to us for the $750,000?
We are still on track.
Run the
yes.
operation.
Yes.
Okay.
We're currently within our budget expenditures and still on track.
Okay. So I think you mentioned one time 45 was our break even. We think we'll have that many in the program by this.
Well, the plan laid out that you'd have to add so many per month, and I don't remember what the number is, but we are on that. We are within our plan.
Okay. And they understand that once they reach that goal, that break even, that our money will cease.
Yes.
Okay.
They do.
And I think there's probably a mortgage on the building. Is that correct?
They pay it.
So they will. They're not paying that back currently. Are they?
I think so.
Are they paying that on a monthly basis?
I think so. Yeah.
So that will continue after. But the 2 times that we have subsidized them, those were grants, basically.
That's
from
right.
us.
That's right.
Okay. And then the other question I have is on the dental program. Do you have an estimate, or could you maybe get an estimate for us of how many dentures we're providing during a year's time? I would like to get with you possibly and look at the requirements on the denture program, if you might be able available sometime.
Okay. Sure, just let me know.
And maybe could you email us those numbers? Is that currently, is the denture program currently coming out of the same program that we established for the artificial limbs and the hearing aids and the
Eyeglasses and
yeah,
dentures.
how's the funding in that part now? Are we still in pretty good shape?
We just are moving some over there. You know what? I think what we got was intended at least for 6 months until the audit was finalized. And so now that the audit is finalized, I think we've sent through a budget mod to move some from our carryover over to it,
So if
to
folks
replenish it.
at some of the clinics have been told they're on a waiting list or something of that nature, they should see that pretty well open up.
Oh yeah, as soon as we get the
Fairly
budget
quick.
mod approved, yeah.
Thank you.
Counselor Snell.
List on the contract health. Get a lot of calls down in my neck of the woods. Is our participants there, are we in the wrong area? Right, okay. The lady was taken from Twin Oaks to Silent Springs Hospital. And the Cherokee Nation Embassy took her up there, she had a heart attack. So they send contract health and she gets her denial and says you should have went to Claremore. If you went to Claremore, she probably need Jerry's services instead of contract health, you know. But anyway, the contract health turned her down, denied her claim. The reason why was she should have went to,
Did she appeal it?
she appealed it, right?
Okay. Did she get denied a second time?
Well, not yet.
Okay.
But we've had several, I mean, that
Well,
wouldn't.
most people automatically get denied on an emergency call-in. And the reason is because we have no information on it. And that's why they need to appeal it, because they need to submit that information.
But that request is on the denial, that she needs to submit all her information.
But his contract's out of Claremore.
Well, I don't know, I'd have to look at the
Well,
patient.
his county is out of Claremore. It's not out of ours.
Well, I'm sure it's the same thing with you all.
It is.
They need to appeal it and submit their information on that.
Counselor Buzzard.
Yeah, Melissa, I have a couple of questions.
Okay.
And one of them was with dentures, and I think Councilor Glory addressed it, but our clinic in Jay, I've had calls from people that aren't able to make appointments, and they're saying I'm not going to make any until June. Before they were telling me they weren't going to make any until April, but here it is April, now they're saying I'm not going to do it till June. And I think I emailed you that.
You have, I just haven't gotten a response from Dr. Hammond.
Anyway, if you would check
He's
onto
gonna-
it and
I
see
am.
if we can't get that rectified. If we need more dollars in it, I'm sure the committee would actually.
Well, we
do that.
have submitted a budget
Okay.
mod, it's just not had time to go through the process, I guess.
The other thing.
But he's gonna give you, we'll get you a response, he just hasn't responded yet.
Thank you. The other question I had, I was looking at third-party collections, and of course, I'm from Delaware County and the clinics in Jay, and I was looking at third-party collections, and it's down. My analysis looked to me like the Jay Clinic and the Salina Clinic see about the same amount of patients.
They do?
Although the Jay Clinic is down a little over $275,000 in third-party collections. Now I thought, well, maybe people up here don't have the insurance that we have. They're not as rich as they are around Salina and Pryor. But then I got to thinking, that's not the case. We have people that work at the school, they're all insured. We have people who work at the county, they're insured. People at the courthouse, they're insured. City, Cobb Manufacturing, they're all got insurance. Simmons, they all have insurance. I say all, a majority of them. Then you have people that work at McKee Baking, they certainly have insurance. Then you have the Cherokee Nation employees, you have housing, Medicaid, and Medicare, but I just don't think that we shouldn't be almost $300,000 below another person's clinic that had almost the same amount of patients. Now, I've looked at all the other clinics, and all of them are ahead of schedule from year to date, except J Clinic, the Guy Dugan Clinic, and Bartlesville.
That's correct.
Anyway, I just want to take a look at that and see if we're not.
We are.
Okay, so you're already on top
Oh,
of this.
yeah, we take, every time one's down, we investigate. We'll meet this afternoon on it and
Okay.
find out what the issue it can be a lot of things.
And I'm sure they are, but it just really caught
It
my
could
attention.
just be that we got, part of the problem, and it may not have been shown up in this, is that, we bill under Hastings' number.
Well, that was my next question.
And because
Is that part of
Hastings
it?
stuff
Yeah.
was messed up, we didn't get a lot of our payments from IHS until like February.
And
I
I thought
think
about
just in
that.
like the last 2 weeks, we're actually caught up, aren't we? So that possibly could be
And
it.
I thought of that, but then I looked at all the other 6 clinics, and they're all ahead of last year today.
But we might have got their payments. I mean, I don't know.
Well, at
But
least-
we do look at it, yes.
Yeah, well, I can certainly appreciate the fact that you're going to look at it, because just want to make sure, that we're getting the money that's probably due us up there from the people that's got insurance. So that was a comment. The other thing was last year, I think we talked about submitting a submittal to the Indian Health Service for the clinic in Jay. Do you know if that department's got that submitted yet?
Well, there's not anything to submit until there's money in the line item, and there's not money in the line item yet.
And I think when Sean Terry was here last year, he told me that he would submit that this last fall, so I don't know why he told me that.
Well, but it's because when the appropriations come out, we anticipate that there's money in there,
I see.
but there was not money in there.
Okay.
And so as soon as there's money in there and they open up for proposals, we're going to submit.
Thank you. And one last question. I asked Jack Farm about this yesterday, because it was those door openers, those handicap door openers at Jay. I think you told me before that you put it over in their department to get those things taken care of. And still haven't got them done yet, but I just wanted to bring that to the forefront again and let the health department know that we'd still like to have those automatic door openers.
Did you say you asked him?
I asked him yesterday, and I think he said it was in his budget to get done, so apparently he's aware of it. Okay. Thank you, Chad.
Councilor Callan Watts.
Thank you, Mr. Chair. We're always beating you up, so I thought I'd give you some kudos.
Thank you.
I have a friend whose mother has a significant number of ailments, and she is always bragging about the PACE program and about how it has absolutely been a lifesaver, because they had to move mom into the home with them. And so if you would extend to Ben and them, it is absolutely just all the things you promised us when we talked about adopting the program, enhancing quality of life, and I believe it's probably lengthened her life as well. And she's always glad when those doors are open, because it brings her a lot of relief. So
Thank you. It's a great program. It's a nationally known program at Cherokee Nation. Thank you.
Thank you,
I'll
Mr.
pass
Chair.
that on.
Councilor Soap.
Yeah, Melissa, you may have confirmed this before, but if you would just confirm for me again that whether or not the gastric bypass and the lap band procedure are approved IHS procedures.
Approved IHS procedures.
From I guess from a contract health standpoint. Or
No, they are not.
Okay, so neither one of those
No.
procedures are.
No
IHS.
bariatric surgery is an approved procedure under contract health.
Councilor Baker from Cherokee County.
Yeah, I was gonna give you kudos, but since you already got them,
Oh, come on.
PACE program, it's on track,
Yes.
one here. Then Stillwell's gonna
Be next.
be next, and then I assume we'll supplement them for a period of time,
I don't know the answer to that.
okay? And then the other question was on third-party collections. Hastings is down $3 million.
Right.
But do you anticipate now with
Absolutely.
to get it back up or above?
Absolutely.
And how long do you think that'll take? Best guess.
I don't know. I mean, as far as seeing it on paper, I know that by the end of this week, we'll be able to start submitting the claims.
Okay.
And I think it'll probably take us 30 days to get all the back billing done. all those claims submitted. So it'll, to actually show up on paper, it's gonna take a couple of
Any
months.
estimate of how much back billing you've got?
No, I don't.
Okay.
I know there was about 3 weeks ago, it was over 11,000 claims. So,
You
yeah,
don't have a dollar.
I don't have a dollar.
Attached to that. Okay. Okay.
Counselor Baker from Adair County by way of Oklahoma City.
Yes. No, the other way around.
Oh.
Good point.
Well, I want to
According to
say good work on the third-party collections for the clinics also, because I see that it's up considerably overall. But I have a request in the report to show the total collected for the month on the third-party collections for the clinics. Could you also include the total collected year-to-date for this year, compare it to the total year-to-date last year? I mean, we have the chart by clinic, but not a total amount.
Okay.
If so, I'd appreciate it.
Sure.
Thank you.
Counselor Buzzard.
Melissa, I just want to follow up on the billing that we didn't have the control number. Now, the J Clinic, they would bill through the control number out of Claremore, right?
Yes.
And-
No? Yeah, we changed it. They did. That Jay, that's what I was thinking. That's why I looked at Glory. I was trying to remember. But Jay and Salina and Nowata and Bartles and Veneta was under Claremore. But when we compacted Hastings, we requested CMS to move them all under Hastings.
Oh, so they actually come. from-
Because we're all part of a system, so they have done that now.
Okay,
So
thank you.
it was affected.
Thank you.
Counselor Baker.
Yeah, I guess I will do some kudos after all. I had a little lady last night, and she was so excited. She was telling me that she had lost 28 pounds, and that her body mass had gone from 28 to 24. I mean, she just rattling off all this stuff. She'd never been an exerciser in her life, and but she doesn't live far from the gymnasium or the fitness center. And apparently she hits it every day, and she says best thing Cherokee Nation ever did. So.
Wonderful. Thank you very much.
And she's 80 years old.
Oh yeah.
Never felt better in her life.
Gosh,
Yeah,
that's
yeah,
awesome.
80 years old.
That's great. That's a great story.
Anything else?
Thank you.
Oh, Counselor Baker.
Yes. In regard to that, I had a call that a lady suggested that we work with the nutrition centers and possibly have some exercise machines placed at the nutrition centers.
We do work with some of the nutrition centers, our health educators. At some of them, it depends on the nutrition center and if they want you to do it, and if they're interested in all that. But they actually had, we were conducting some exercise classes for elders. I went to one of them one time, and they were all sitting there in the class, and they were acting like they were driving a car, and, they were moving. So we do some of that. I think we just even recently videotaped it, the classes, so they could play them in there when they wanted to exercise. So we do some stuff.
Okay, but they were actually wanting some equipment at some of the centers where it wasn't readily available anyplace else in the area. So you might keep that in mind. Thank you.
Counselor Callan Watts.
While we're on the request, my Rogers County elders want another exercise class, and they want a nutrition class. It was an absolute hit. We had whole families and elders out there. And I guess we don't have the budget right now for the
That's
nutrition
right.
class that was being offered in Bartlesville, and they have repeatedly requested in writing from me. So I think I've told you.
We're working on it.
Okay.
The problem is that, we've never been, we've never had we don't operate the health facilities in Rogers County, and that's where the money is. It's associated with those positions. And so we've never had a health educator funded from that area. So we're just going to have to, we're working on it though. We're going to have to figure out how we can do
Community
that.
building, I mean, they open and they'll keep it clean and all that. I know there's more to it, but that place, and they've pushed all the chairs aside, made room on the floor, kept it swept. So
We never had one at No Water, and we finally got one there. And They're so busy.
Mhm.
So, we're working on it.
They love Jamie, so thank you.
She's awesome.
Counselor Snell.
Melissa,
Yes, sir.
on these exercise machines that's in, like in the schools and the little community centers and stuff, did y'all install them, or what I'm trying to get at? There's a lot of them up in my area that don't work on the, like the,
No, we did not. I assume, I mean, I don't know without knowing exactly where you're talking about, but they could have gotten them from several different ways. One is that we gave out grants to schools for some fitness stuff, and the schools actually bought them and was just to maintain them and take care of them and administer them and all that. So they may have gotten them through a grant that our community health program gave out to schools for fitness stuff.
so there wouldn't be no funds to repair those? Like
The school would have gotten a
school-
grant. Yeah.
Anything else?
Thank you.
I have a question. I'm not putting you on the spot. I'm just going to give you a scenario. If you had a Cherokee citizen lived in the jurisdiction of Cherokee Nation, had surgery in Tulsa, is there any way that the Creek Nation Contract Health would pay for that surgery?
Yeah.
Okay.
Muskogee County. Wagner, does that have some Wagner?
How about Warner?
That's Muskogee.
That's Muskogee County.
It'd be Creek Nation.
That's what I want to know. Thanks.
Thank you.
Next, old business, we have none, and new business, employee health plan briefing. I know Amy's here. You're up.
I'm Amy Brill, I'm the benefits manager, and we wanted to give you some information on our health plan. We have a PowerPoint here. We're going right now through our open enrollment process, so we thought this would be a good time to give you some information on it. I need to turn that on.
She's got the building part of it.
Oh.
We don't know why.
I was watching it, make sure it was smoke coming out of it.
This slide shows the average coverage election for on the national average for employees who elect coverage on a health plan is 82%, and 93% of our employees elect coverage on our health plan, which I think is really good. And we did do a survey not too long ago of those that did decline and the reasons why. And a lot of them did have coverage through their spouse at another place of employment. There weren't very many that declined based on the coverage or the cost of the plan. The Cherokee Nation plan is self-insured, and so this shows the cost of what it costs Cherokee Nation for the health plan. For single coverage, ours is a little higher than the national average per person, and family is a little lower. But Cherokee Nation does self-insure the plan. And this is a slide that takes a look at the average annual employee contribution on our plan. So employees do pay lower than the national average for both single and family coverage on the Cherokee Nation plan. This is our average employee contribution compared with the national average. For single coverage, employees pay around 8%, and for family coverage, the level is about 13% of the cost, and Cherokee Nation picks up the remainder of that cost. Our in-network office visits, if you go to a provider in the network, you're going to pay a $20 copay for a primary care physician and a specialist physician on the Cherokee Nation plan. The national average for a primary care is $19, and the national average for a specialist is a $26 copay. So we actually pay the same copay no matter whether you go to a primary or a specialist. This is our annual health plan deductible for an in-network provider. It's single coverage, $250, so we're a lot lower than the national average on both the single coverage and the $750 deductible for family coverage. And those were compared with PPO plans. So we're looking at comparable statistics there. Our coinsurance, the national average is 17%, and ours is 10, and we are changing that to 15. Now, what coinsurance is if you go, mainly it affects people that go to inpatient hospitalization, but there's other things that go to coinsurance, like chiropractic care. So if you go inpatient, you're going to meet your $250 deductible, and then the plan's going to pay, previously it was 90%, you would pay 10. That has changed as of June 1. It's going to be 15% is what the employee would pay, and Cherokee Nation would pay the remainder after you meet the deductible. And the other entities are at that same level, so that was something that was changed this year. Our co-payments for prescription drugs, we are on a formulary, and we compared those with the national average. For generics, we're the same. Employees pay a $10 copay if they go fill a generic prescription. Preferred prescription, if it's a preferred medication, employees at Cherokee Nation pay $20, and the average is $26. Non-preferred, Cherokee Nation, you pay $35. The national average is $46. There's a specialty tier for some of the high-dollar cost medications, and that is going to be added to the plan as of June 1. There is a specialty drug tier that will be added, and it will be a $45 copay. The national average is $75. And you did get an enrollment packet at your home, and it gives a list of those medications that are considered specialty drugs. And anybody that is taking a specialty drug, Blue Cross will be contacting that person to get them transferred over and make sure everything goes smoothly. This is the health plan cost. Cherokee Nation is self-insured, and this is the total cost for claims that are paid out on employees' independence, and also administrative costs that we pay to Blue Cross. And we do purchase reinsurance, and how that works is if we have any employee or dependent that exceeds $150,000 on a claim in a given contract year, then we get reimbursed back. And so those costs are not subtracted from these amounts, but if you want to, I can give you an idea. 2007 and 2008, our claim total costs were at 15.2. We had about $51,000 in reimbursements. That was a pretty good year. We didn't have a lot of high-dollar claims. If you look to 08 and 09, we actually had a reimbursement of about $700,000, and our claims were 18.7. Our claims are projected to go in 2009 and 2010 to $20.5 million. We did add the Housing Authority employees to our plan May 1st of 08, and then the Hastings Tribal Hires came onto our plan in October 1st of 08, so that will account for some of that increase. And that's about a 10% increase in employees that came onto our plan from the prior year, and of course dependents, I think, are about 12% increase in our dependents. Our open enrollment is currently going on right now. Began April the 7th, and it's going to end April the 21st. These are some of the changes that are being made. There is a new age limit on the vision. Currently, your dependents can stay on our medical and dental plan until age 25 if they're a full-time student. And vision was at 23, and that's been increased to 25 on May 1. So if you have a dependent that's a full-time student, they can remain on that plan. There's a new vendor on the accident policy. So if anyone has, I don't believe any of the council have an accident policy, but if you want to sign up for that product, they're going to be here again on Wednesday, or you can call our office and we can make an appointment for you. Premiums are increasing on the medical side, about 7%. That's in line with the total increase to the plan costs. And that information was included in your packet. Coinsurance change, we already talked about that. It's going from 90 to 85%. We added the specialty drug tier we talked about. And this year we're also offering you to have a premium discount if you complete the health risk assessment. So if you did complete that last year, you need to go ahead and complete it again this year so you can maintain your discount. All that information was in your packet, how to get online and do that. And if anybody needs any help, they can call us. And talking about our health risk assessment, I want to show you some statistics from the results from last year from our employees, and these were our 4 top problem categories. Physical activity, we have 68% of our employees that are at high risk. And if you're at high risk on physical activity, that increases your stress level by about 2 times the amount. And it also increases your risk for obesity by about 19%, 19 times. We've got body weight, 47% are at high risk for body weight. Nutrition, 39%, and the same with medical health. Medical health are people with serious health conditions. This is taking a look at our exercise category. We have 8% of employees that totally avoid exercise. We have 35% that do occasional, and this is on a weekly basis. We've got different types of categories from moderate, 10 to 60 minutes, 60 minutes, high intensity for 30 minutes. We've got 3% of our employees doing that. So very high intensity, 3 hours plus a week, 4%. Took a look at body weight. We've got 47% of the people that completed the health risk assessment at an obese level. We've got actually 1% that's underweight. A few overweight there. About half of our people did do the health risk assessment, so these statistics are sound. This is a distribution of our medical conditions. High blood pressure is our major problem area. Hay fever, allergies, back pain. We've got diabetes in there, of course. Depression. These are just some of the top 10 that were our problem areas. Blood pressure, we've got 29% at the pre-hypertension level, and we've got 13% are at the hypertension level. 11% don't know their blood pressure. We've got 47% at normal. That's the end of my presentation. Anybody have any questions about anything?
Yes, go ahead.
Yes. Answer that, I'm sorry.
Amy,
Do you have any questions? Councilor Buzzard?
I think I've asked this question before, and I forgot what really the answer was, is why don't we do medical benefits with our affiliates, CNE, CNI, and maybe look at cutting the insurance, overall cost of insurance down for the employees?
Well, what we did a couple of years ago, we actually, all of our entities did get together. We have a benefits committee that we all get together. And actually it's a interest committee. They look at other things besides benefits. But we got together and we did go to bid together. And we did get a reduced cost on the insurance that year. And then we're going to continue to do that. So every 3 years we're going to look at that, bid it out together. Bidding out together actually does save money if we all go with the same carrier, so we did get some rate cuts that year. And that was at May of 07. That's when we did that.
The other question, and it's a comment, and you may already do it, but just showing the graphs in here and showing us it's could be an inspiration for, and maybe you do this, show it to all the employees that work in the Cherokee Nation. Do you ever show this to all the employees?
No, we do presentations.
I know you have health fairs and stuff like that, but this really has an impact when you actually put it on paper and show employees what's going on. And then, I know you're always advocating exercise and show it this year and show it again a year from now, see if we've improved. So, I don't know, I'm concerned about my health, so I'm trying to do something.
Yeah.
Kind of hard, but that's its comment.
Yeah.
Thank you.
That's a good idea. We do, Blue Cross does a presentation. That'd be good to incorporate some of these slides into that.
Any more questions? Good. Thank you. Next, we have announcements, and I don't have any. Does anybody have any announcements? Other than the next tentatively scheduled meeting is for Tuesday, May the 12th at 10 a.m. And Council Buzzard has one.
Chairman, I'd like to, and I know I'm not gonna ask the question today, but in this committee, could we have someone from HR to come over because, and I guess I've just got a question as why it takes so long to hire somebody at the Cherokee Nation. That is an ongoing problem.
Is that something specific to health, or would you?
No, it's just
You would.
hire.
Well, I see both of our rules people are out of the room. Well, no, there she is. Madam Speaker, we have a request to have someone from HR. One of the question from Councilor Buzzard was there's an assessment that it's taken a long time to hire people into the Cherokee Nation, and he was requesting someone from HR be present. And I asked, was that specifically a health issue? And he said, no, it's everything. Would that be better served at rules?
No, that'd be great.
We'll make sure that happens at rules then.
You want that on the next rules agenda?
If we've got time, I'd like to have.
Yes.
Thank you.
Anything else?
Adjourn.
We have a motion to adjourn. Yes. And we have a second from Councilor Garvin. All those in favor? Aye. Any opposed? We are adjourned.